Good afternoon, everyone. Maine public, we are 1 minute away. Good afternoon, everyone. I'm Nirav Shah, the director of the Maine CDC. I'm joined today by Commissioner Jean Lambrou, Commissioner of Maine's Department of Health and Human Services. Commissioner Lambrou and I are pleased to be with you today to talk about where we are with respect to COVID-19 for the state of Maine for today, Thursday, December 16th, 2021. And Commissioner Lambrou and I begin today's update on a sad set of notes. Maine CDC is reporting the deaths of 27 additional individuals with COVID-19. 12 were women and 15 were men. 20 of these 27 COVID-related deaths in today's update were identified as part of our ongoing vital records review. Those 20 deaths occurred between November 8th and November 30th of this year. These additional deaths bring the total number of deaths in Maine associated with COVID-19 to now 1,405. We'd like to take a moment to offer our condolences to the friends, family members, and communities of all 27 of these individuals who have passed away recently. Statewide, Maine CDC is now reporting a total of 134,170 cases, an increase of 1,286 cases since yesterday. Right now in Maine, 381 people are currently hospitalized. 114 of those individuals are in critical care, and 66 are on a ventilator. That number, 66 on a ventilator, is unfortunately a new high mark for a number of patients ventilated during the pandemic in Maine. It also continues to be the case that 2 out of every 3 people hospitalized in Maine with COVID-19 are not fully vaccinated. And as you look at those who are in the ICU or those who are on a ventilator, that number grows. In those settings, 80 to 90% of patients in the ICU or on a ventilator are not fully vaccinated. Overall, in terms of our hospital bed capacity, there are 40 available critical care beds, 32 of which are adult beds, and 8 are pediatric or neonatal beds. Turning to testing, the positivity rate, the PCR positivity rate in Maine on a 7-day basis now stands at 9.9%. And our testing volume in Maine is at 702 PCR tests that are being done every day for every 100,000 people in Maine. To put that number in perspective, 2 weeks ago, one incubation period ago, the positivity rate in Maine was 11.7%, and today it's 9.9%. Similarly, 2 weeks ago, the testing volume in Maine was 495 per 100,000. Today, it's at 702. This represents a 42% growth in PCR testing volume in Maine just over the past 2 weeks. Let's turn for a moment to vaccines and vaccinations. Right now, Maine is administering 9,882 doses on average every single day over the past 7 days. We're vaccinating right now at a rate that we were vaccinating in late May of this year, which makes sense, given that right now we're asking folks to get their booster shot at least 6 months after they finish their second dose of vaccine. So it makes sense that we're seeing an uptick in vaccines. I'm going to talk a little bit more about boosters in a minute, but these numbers, again, 9,882, show that we are continuing to make strong progress on vaccines. Now, breaking down the composition of those shots for a second, of those 9,882, about 6,745 of those on every single day over the last 7 days are a booster shot, which means that of all the shots that we're giving out as a state right now, about 68% of them are boosters. These are good numbers. They represent a 74% increase in the overall vaccination volume just over the past 2 weeks, 74% increase. And those numbers are translating into strong population level numbers. Right now, across the state, 74.7, just a hair under 75% of the entire population of the state of Maine is fully vaccinated. But we've got more work to do, particularly on boosters. As of this morning, just a hair under 40% of the 18 and over population are not just vaccinated, but boosted. We've got more work to do on the booster front. Which takes me to the last thing I wanted to talk about today. 2 weeks ago, I discussed the Omicron variant and what it might mean for us here in Maine. What I'd like to do today is provide some updates on that front. Now, though we have not confirmed the Omicron variant in Maine, Maine CDC believes that it is here. Indeed, we are actively looking for it, and it's just a matter of time before we find it. With that knowledge, we at the Maine CDC are acting as if it's here. And today, I'd like to urge Maine people to do the same. There are 3 areas that I want to provide an update on as it relates to the Omicron variant. The first, how contagious is it? The second, how severe is it? And the third, how effective are the vaccines? Let's talk about contagiousness. Based on the early data that have been collected by researchers around the globe, Omicron appears to be more contagious than even the Delta variant, which itself was more contagious than prior variants. Omicron spreads more easily from person to person in different ways. Some studies suggest that it spreads more rapidly and more easily because it multiplies more quickly in the body. Others suggest that it also might gain a better foothold and be better at commandeering our body's cells in order to use that as a site to replicate. Other studies and case reports still suggest that it might be able to be transmitted in a shorter window of time. Some combination of these mechanisms are at play in order to lead to the greater contagiousness that we're starting to see in countries where Omicron is ahead of where it is in the US. Countries like Denmark, for example, where their growth curves are looking vertical right now. The second question is, how severe is it? And here, there are some glimmers of hope. There have been 2 papers that have been put out by colleagues in South Africa, which suggest, and it's too early to know for sure, but suggest that Omicron might not be more severe than Delta or previous variants. How much less severe it may or may not be remains to be seen. Now, this is undoubtedly a glimmer of hope, but I want to put it in context. Severity is a marker that matters between a healthcare provider and a patient. It's what you worry about when you're caring for that patient in the moment. From a public health perspective, a population perspective, we're focused on severity, but we're really focused on the first thing, contagiousness. When it comes to assessing the impact of a new variant on things like the strain on our healthcare system, contagiousness ranks higher than severity because contagiousness is a measure of how many people might end up in the hospital. Even if the Omicron variant proves to be 20 or 30% less severe, if it spreads 1.5 or 2 times as easily, even a fewer number of patients who might get affected on an individual basis, when multiplied across the population, given its greater contagiousness, that's really what might drive continued strain on the healthcare system. And then the third question, How effective are the vaccines? Well, there are some concerning news as well as good news. Let's start with the concerning news. The early data we have suggests that although vaccines remain effective against Omicron, and at least according to top federal health officials like Dr. Fauci, we might not need a new vaccine. There might be a slightly diminished effectiveness if you don't have a booster. I want to say that again. Some early data suggests that, for example, if what you've got on board are 2 shots of the Pfizer or Moderna, you might not enjoy the maximum protection. But here's the better part. The same set of early data suggests that when someone has a booster of Pfizer or Moderna on top of their first 2 shots of those vaccines, their effectiveness against the Omicron variant remains strong and robust in the range of preliminarily around 70%. So what does all of this mean for you? And what should you do today to be ready for Omicron? Well, first of all, you should get vaccinated. There's no surprise there. But the second thing, and the thing that's growing increasingly important with each day's new data on Omicron, is the importance of getting a booster. If you've been vaccinated and it's been at least 6 months since your second shot of Pfizer or Moderna, or 2 months since your single shot of J&J, you should get a booster, period. Boosters were important before, they're more important now. As I mentioned, having had a booster on board restores the performance of the vaccine to a strong level. Now, in recent weeks, we know that finding a shot has been a challenge. That's why, for example, in response to the concerns that we heard, the state of Maine opened up a vaccine site here in Augusta at the Armory. That site is open today until 7 p.m. So if you're looking for a booster shot and coming to Augusta before 7 p.m. is available to you, we will be at the Armory. Other partners have stepped up too. Northern Light Health has opened up sites in Bangor and South Portland, and this is on top of existing sites that have been and continue to be open, like the one that York County EMA runs in Sanford, and like the one our colleagues at Central Maine Medical Center, working in partnership with local groups, have been running at the Auburn Mall. Beyond those large-scale sites, community partners have come together to offer clinics across the state, from Kittery to the county. Clinics are available. Maine CDC, for example, and a local pharmacy administered 271 doses at a clinic in Machias yesterday. These sites are increasingly coming online to respond to the demand that we are seeing for shots of all types, boosters in particular. We are keeping track of those sites on our website. To find a list of those sites, go to Alta Vista and search for Maine COVID-19 vaccination sites. There you'll be taken to a site that lists, and you can search for sites that are available in your area that are offering the shots that you're looking. So with that, we're going to turn to our colleagues in the media. And the first question today goes to Megan from WMTW.
Thanks for taking our questions. The first question is kind of more a logistical question, I guess. I heard from a viewer that they had both doses on board, but were vaccinated in April, so the effectiveness had waned. And in the meantime, waiting for a booster, they unfortunately tested positive for COVID. So they're wondering now, willing to get the booster, how long should you wait after a COVID diagnosis to get a booster?
Great. Megan, that question's definitely come into us too. So thank you for raising it. Happy to address it. The answer is you can and should get your booster. Even if you had your shots, you had a breakthrough case, you can and should go get a booster. And the time to do so is when you've recovered from your bout with COVID. For most people, not everybody, but for most people, that's about 10 days after you've started feeling your symptoms. Now, the reason we say that is it's not that there is an immunological reason why you can't get a booster while your body's contending with COVID. It's more that while you've got COVID, you should be inside isolating and not spreading it around to others. So once you're free and clear and that your risk of spreading COVID is minimized, then you can and should go get a booster. That answer is on our website in our FAQ section. And so if you want the exact verbiage, Megan, you can find it on our website.
Great, thank you. And my last question, one last question is, we recently marked the anniversary of the first shot here in the state, and I believe, or in the United States in general. And I also, I think we all hoped we'd be in a different place right now. And a lot of the news isn't great. So is there something that you can suggest or that you can say that we should be hopeful about and that is positive?
Again, I really like that question. I'd love for the commissioner to weigh in as well. Because sometimes sometimes I just feel like a perpetual thrower of wet blankets, and that's not fair, because there are good things happening. And I'll note two right now, Megan. The first is what I hinted at. In response to the need for boosters to get out there, we put up the bat signal to community groups across the state to say, Maine people need your help getting shots. Whether you're a local independent pharmacy, a small hospital in a rural part of the state, whatever the case may be, can you get together and offer boosters for your community? And we saw overwhelmingly people come together and say, absolutely, we can make that happen. Similarly, we put out a call for volunteers not long ago to help out with all the various missions that we're running. And we've had so much support from people in Maine who have said, yep, I'm going to volunteer my time. Now, Megan, I know your question was, I think, more epidemiologically, but I wanted to note that this has been an example of the ways in which even a bad situation can foster cooperation and community spirit, even though times are bad. From an epidemiological perspective, this is something we haven't talked about, but it's important. Outbreaks continue to happen, but the nature, the structure of those outbreaks is different now in the vaccine era than in the pre-vaccine era. The outbreaks now have tended to be smaller, particularly those at, say, long-term care facilities. And when individuals who live in those congregate settings have been affected, their likelihood of being only mildly symptomatic, or, for example, being completely asymptomatic, is much higher now than it was in the pre-vaccine era. Similarly, the percentage of people who have been affected by an outbreak who then find themselves in the hospital is a lot lower than it was before. So there are hopeful signs on the horizon, and thank you for at least noting that we should talk about those. Commissioner?
Two more factoids. One is, as Governor Mills noted the anniversary yesterday, we have 75% of all Maine residents are fully vaccinated, and many more are on their way to be boosted, which is just phenomenal. That means over 1 million people in Maine are fully vaccinated. And we just thank everybody out there for all the work that it took to get to those marks, as well as those people who got their shots. But I also think it's notable, just taking one example, as Director Shaw just mentioned, of long-term care. Maine is number one in the nation on the percentage of its nursing home staff that are vaccinated. And we're number 3 in terms of the percentage of our residents who are vaccinated. And we have seen a recent study published in the New England Journal of Medicine showing that when staff are highly vaccinated, the number of deaths in nursing homes is lower. It makes a difference. Sometimes it's hard to see it, the prevented death, the prevented hospitalization, but the numbers are solid, and that's a real effect of the work that we've done in the past year.
Great. Thank you, Megan. Let me go to Marissa. Yep. Sorry, Megan, I cut you off.
Oh, I was just saying thank you.
Oh, you're welcome. Let me go to Marissa next.
Hi, Dr. Shaw. One question we had is, are Maine hospitals having a hard time discharging patients who need long-term care because of a lack of beds or staffing at nursing homes and assisted living facilities?
The answer is yes. And Commissioner, I'll turn it over to you. And sorry, Commissioner, you're muted there.
Sorry about that. Yeah, we have been concerned about this all along. Back up that we've had a healthcare and nursing home staffing shortage pre-pandemic. The pandemic exacerbated it. partly because of the burnout, partly because of just the work that it takes to keep those facilities open during a pandemic with outbreaks and extra work. All that said, we continue to have a really strong partnership with our nursing facilities where we one by one work with them to figure out what are their needs, what are the flexibilities that we can offer, how can we really support them in partnership. And a good example of that is a waiver program that we announced about a month ago waivers have been approved in about a dozen different nursing facilities in Maine. They've opened up 24 beds already, and we continue to do that work. We continue to try to figure out other ways that we can support that. As a reminder, one of the deployments of the National Guard right now is to a nursing facility that will be open to patients being discharged from a medical center to decompress at hospital. So there's a number of examples of effort that we are making to try to support our nursing facility in opening up those beds to further decompress our hospitals.
Great, thank you. My other question is just that I know Maine CDC is now sharing once a week on Thursdays the number or the percentage rather of patients who are not fully vaccinated in the hospital. We're getting a lot of questions about why that's not reported daily along with hospitalization. So just wondering, Dr. Shaw, if you can address that.
Sure. Marissa, it goes back to something I've hinted at before. Every piece of data requires multiple people to make it happen. Every ask, every factoid, every data point. In this particular instance, we ask hospitals to go through every single patient whom they are currently caring for and ascertain and then report the vaccination status. That's a process that takes time, especially as we have record numbers of people in the hospital. The other question that we have to ask ourselves is, given that that number has remained quite stable for several weeks, if not months now, what are we gaining by asking hospitals to take on this burden every single day rather than once a week? If we were seeing large fluctuations between Monday to Tuesday to Wednesday, and there were action steps that we would take in response to those, then without a doubt, we'd want it every day, as we do the number of patients who are on a ventilator, for example, because it means we can move ventilators around if we needed to. With this number, given the stability and given the demands on hospitals, we believe that once per week gets us what we need in terms of knowing what's going on. Let me go over to Brian Sullivan next.
Thank you, Dr. Shaw. This one is probably for Commissioner Lambrou. Seen some other New England states make free at-home tests available. Are there any discussions among the state officials to make that a reality here in Maine?
Yeah, we are exploring all options to expand testing capacity, both at home as well as in our different sites. We're excited to see that a new testing option is opened up at the Portland Jetport. We're working with other facilities to expand testing throughout the state and looking at all those programs that could be stood up to improve access to at-home testing.
But more of making them available that people could apply to have the test and have them at home, not going to a location. Is that is something that's being considered?
We're considering it. I would just note that, New Hampshire, for example, had one of those programs. It was a pilot program that was a one-time program that is over. I think people are trying to learn from those pilots about what works and how do they work. There's a lot of questions involved in it. All that said, we are exploring all options at the governor's directive.
And Dr. Shaw, this one's for you, and Commissioner, you can obviously weigh in if you'd like. Based on what you just said about urging people to get a booster shot, what would be your definition of fully vaccinated? Does it still remain the same as we sit here today?
Yeah, Brian, that's a really great question. It's one that I've had the opportunity to discuss with counterparts of mine across the country, as well as with the CDC in recent days to review the latest data. Here's the bottom line. The definition of fully vaccinated has not changed in Maine or across the country. That is to say, 2 weeks after your second shot of Pfizer or Moderna, or 2 weeks after your single shot of J&J. That has not changed. But with each passing day, the importance of boosters becomes more and more evident, especially as we see Omicron inching closer and closer and closer off the horizon. It's possible that the US CDC will change that definition of fully vaccinated, although there are ripple effects from that. But right now, the definition hasn't changed. But Brian, don't let that definition be the thing that prevents you from going to get a booster, right? Don't be there saying, hey, I don't need a booster because I'm, quote, fully vaccinated. Yeah, you are as a technical matter. The question you should be asking is, am I fully protected? And there, every single day, we learn more and more about the importance of boosters.
Thank you. So fully vaccinated with an asterisk.
You're still fully vaccinated as a matter of various regulations and compliance, but the question I urge everyone and their families to be asking is, am I fully protected? Am I fully, truly up to date, given the emerging science? And there, getting a booster helps you be fully protected. And that's really what matters.
Thank you.
Yep. Crystal, let me go to you next. All right, Crystal, I'll come back to you in a second. Let me go to Joe Lawler next.
Yes, hi. Just following up on Omicron, I think there's been some reports of other states that are reimposing some restrictions, mask mandates. Cornell University shut down their campus after some cases. And so does the emergence of Omicron, do any of these restrictions have a potential to come back in Maine?
I'll begin by saying we have no plans at this time. We always study evidence and what's going on in the world, and we'll continue to do that. And we do know, at least preliminarily, as Director Shaw said, that vaccines appear to be effective against Omicron. So our first line of defense is vaccination, but we had no plans to change our protocols at this time.
Okay, and then following up on that, so I'm thinking about, as the potential for schools to have more and more cases if Omicron becomes dominant. If a student is there any thought about changing the standard of, like right now, if a student is fully vaccinated, if they're a close contact, they don't have to isolate and can continue going to school, also with the pooled testing program. But I'm wondering if that changes now because of, if Omicron becomes dominant because of the reduced effectiveness of the vaccine. Your thoughts on that?
Yep. Joe, it's something that our epidemiology team has discussed, and I know that in other states, the same question has come up. No changes at this time because there are still questions, scientific questions, that the scientific community is getting answers to. What is the nature of Omicron in children? Do the cells in their lungs necessarily work the same way in terms of viral replication as those in adults? Things of that nature. I hear what you're saying in terms of what it might mean for students being out from school. Right now, we're not changing the definition of fully vaccinated as it relates to kids not needing to quarantine if they're exposed in schools, because again, there too, the vaccine data that we've got suggests that the vaccines do quite well, but this is changing every day. So that's not a definitive statement forever and ever. It's based on what we know right now today. Let me go over to Amy Brown next.
Thank you, Dr. Shaw and Commissioner Lambrou. I have a couple of questions today from listeners. One who recently tested positive, is symptomatic, and is trying to determine when they might have been exposed. And they ask how many days after exposure symptoms typically develop, and also does that vary by strain?
Okay, so generally what you're referring to there is what's called the latency period, the time between exposure and symptom onset. And with COVID, it does vary by person to person quite a bit, but it's generally speaking anywhere from 2 days to about up to, in some cases, 12 to 14 days when symptoms can start developing. Most people, however, who have symptoms start developing their symptoms on the early side, days 2, 3, 4, and 5. Okay. And based on the strain, it doesn't really vary by strain. in material ways.
Okay. And two other listeners wrote in with sort of variations on the question of when is it safe to be around someone. One person was asking about when it is safe to be around a person who has just recovered from COVID but hasn't been vaccinated, if that's a factor. And another wanted to know when it's safe to be around somebody who has had a possible exposure. Is it as soon as they test negative, or if they don't get tested again, is it a specific number of days?
Yeah, Amy, I'm glad you raised this today because we're so far into the pandemic that a lot of these questions, which I think we all grappled with, are, the first weeks. I'll be honest, I think a lot of folks have just. It's good to talk about these things from time to time. So let's talk about recovery first from having active COVID. And the bottom line there is that once you've been, quote, recovered from COVID, your likelihood of having enough virus in your body still such that you might transmit it to someone else is thought to be quite low. And that is, generally speaking, around 10 days or so after you've had your symptom onset. It's not a hard and fast rule. And there are some caveats, all of which are available on the US CDC and the Maine CDC's website. It has to do with how many days you've gone without having symptoms, things of that nature. So it's driven largely by resolution of symptoms. And after those symptoms have fully resolved and a number of days have passed, you can safely be around others with minimal chance, not zero chance, but minimal chance of passing it on. Similarly, for those who have been exposed, if you've been exposed to somebody, you should be in quarantine. And so you shouldn't really be interacting with others. Now, in some cases, that's impossible to do, like in a household setting. So those others who you might be interacting with, if you've been exposed, you should try to minimize that as much as possible. You should be wearing masks indoors, trying to stay in separate rooms where possible to reduce the likelihood that if you've been exposed and you develop COVID, you then go on to infect the house.
Great, thank you.
Thank you. Let me go to Carol from Maine Public.
Good afternoon, Dr. Shah. Thank you for hosting today. The rural counties seem to have the lower vaccination rates, and you talk about the contagiousness of Omicron as well as Delta. With the new vaccination clinics taking place, can you talk about whether vaccine rates are improving in the rural areas? Are people coming out and getting the shots as you've been asking?
Yeah, we've seen them increase, but we've got more work to do in rural counties. That's the bottom line. I think we have more work to do on our end to make sure that access is there. We've been doing that. For example, we worked with providers up in the county yesterday to host clinics at an area restaurants. We send a team of nurses to Machias, as you heard me mention, where they did well over 200 shots just yesterday alone, 271. And so we're working on access in rural counties, but we've also got more work to do to make the case for why folks in those counties should get their first shots or their boosters. Things have been improving, but again, I don't think we're there yet.
Thank you. I'm all set.
Thanks, Carol. Crystal, are you on? All right, I'm going to go over to Caitlin at the BDN to round us out.
Good afternoon, Dr. Shaw, Commissioner Lambrew. Wow, we are flying through this briefing today. Few questions that I have. We've seen it kind of gradually ever since the state of emergency has ended, the state adding back, some efforts that were kind of hallmarks, I think, of the beginning of the pandemic, specifically thinking about the ongoing vaccination clinic at the Augusta Armory, adding back CDC staff to process testing, things like that. With us going into year 3 of the pandemic, what direction do you foresee the state's efforts going in to fight the pandemic next year?
I'm going to start by just adding some additional areas where we've done that, Caitlin, where we've brought back some blasts from the past. You heard us reference that we've set up more testing sites. There's a new testing site at the Jetport. We're also working with a community adjacent to Portland to bring back another testing site there and looking at other locations where we can resurrect things like swab and send sites to make testing more available. So that's just one more example. We've always had some things like the community vaccination lines things of that sort that we've never really taken off since now a year. So, but more generally speaking, there's not a date on the calendar, Caitlin, as to when we'll pull back. We're in this for the long haul. No one knows how long that's going to be, but I think it's safe to say that Commissioner and I have and our teams have been working 24/7 for now 2 years, and things are looking concerning. We're not easing up.
So do you anticipate that we might see more of those efforts, like additional ramp ups of things that, if we're not talking about bringing back restrictions, maybe bringing back more of a stronger, full court press around vaccinations, making them more available, things along those lines?
I can't predict that we will do those, Caitlin, but I could definitely say we're prepared to do that if needed.
Oh, I'm sorry, you cut out there a little bit, Dr. Shah. Can you say that again?
Shoot, that was a good soundbite. I can't predict that we will do those things, but I can say with confidence that we are prepared to if needed.
Thank you.
And I think I cut the commissioner off as I was saying something. Oh, no, okay, we're good.
Thank you. And I guess my partner question to that is that, we have seen for a time that the greatest amount of spread is happening in the state's least vaccinated counties. And I'm wondering if we've considered standing up vaccination clinics there, or is that not really the problem that we're seeing in these counties?
Caitlin, as I noted in response to Carol's question, access matters, and we want to make it as easy as possible for folks in rural counties as well as in urban counties to get their shots. That's why, I just mentioned just 2 opportunities in the past 36 hours that we've stood up. The one in Machias, where was highly attended, 271 shots, and then 2 opportunities that occurred yesterday up in the county, both of which were well attended. So we're going to keep doing those. We found that those occasional events that we bring a lot of folks together for have seemed to have been much better attended than the sort of constant. So we're going to keep plugging away at that.
Thank you.
Great, thanks, Caitlin. And as Caitlin noted, those are the end of our questions. So Commissioner, I'm going to turn things over to you for any closing thoughts.
Great. I would just say, when we talk about the strain in our hospitals and our health systems, those hospitals and health systems are still providing access to services, both for people with COVID-19 as well as other people with other types of serious illnesses. I hope that everybody in this holiday season does thank a healthcare worker. These are hard jobs. There are jobs, we talked about the strain on us for the past 2 years. Just imagine the strain of continually having to gear up in PPE to really try to go into these facilities and try to make do with an ever-shifting pandemic. Our healthcare workers are true heroes. So I hope during this holiday season, any of you has a family or friend who works in a healthcare facility, a hospital, a long-term care facility, EMS, behavioral health, just thank them because they're doing amazing work. Thank you.
Agreed. Thanks, Commissioner. And thanks to all of our colleagues in the media for hopping on this afternoon. Thank all of you for taking a bit of time out of your afternoon to hear where we are. As always, please be kind, take care of one another. We'll talk again soon.